Imagine bringing home a newborn, only to have a sudden, invisible switch flip in your brain, trapping you in a nightmare where nothing feels real. This goes far beyond the typical exhaustion of a new parent. It is the onset of a condition called postpartum psychosis. This medical emergency is at the heart of the legal defense for Linda Lacy. Understanding the science of this condition helps explain the total loss of control that occurs when a mother's mind is overtaken by a biological crisis. To see how rare this is, look at these 1,000 dots representing global births. Only 2 of them change color. That is the statistical reality. Postpartum psychosis affects roughly 1 or 2 out of every 1,000 deliveries. When it strikes, it moves with terrifying speed. Within just a few days of delivery, a massive biological crash destabilizes the brain, causing a person to lose their grip on what is real and what isn't. This means the condition is a physical, medical failure of the body's systems. It isn't a reflection of a mother's character, her parenting skills, or how she handles the normal stresses of a new baby. In psychiatry, doctors use a standard manual to identify and treat diseases. However, if you open this rulebook today, you won't find a standalone page dedicated specifically to postpartum psychosis. Currently, doctors have to categorize it as a side effect of other disorders, like bipolar, and simply add a note that it happened during the period after childbirth. This lack of a specific label makes everything harder. It leads to inconsistent treatment plans and leaves families in a difficult position in court, where lawyers struggle to prove a disease that isn't officially recognized. Lumping this crisis in with general mental health issues hides the specific biological triggers, which can prevent a mother from getting precise, life-saving care. The defining feature of this illness is a broken reality filter. A mother's state can swing wildly in just a few hours, moving from highly energized, frantic activity to a state of total frozen silence. To understand why this is so dangerous, we have to look at how it differs from postpartum OCD. In OCD, horrifying, unwanted thoughts are blocked by her natural instinct to protect the child. Her reality is intact, making infanticide risk incredibly low. But in postpartum psychosis, that protective shield shatters. The terrifying thoughts become a new, absolute reality. Because her internal compass is broken, she may follow delusions into tragic actions, fully believing that what she is doing is right. Confusing these 2 conditions is a major clinical failure. Attempting to treat psychosis with talk therapy meant for OCD leaves both the mother and child in a life-threatening situation. So why does the switch flip? The trigger is purely biological. Immediately after the baby is born, the high levels of hormones that sustained the pregnancy suddenly crash back to 0 in just a few days. This is like a massive chemical withdrawal for the brain. It removes the natural calming hormones that protect our nerves, leaving the system hyperexcitable. At the same time, the brain's excitement signals get stuck on maximum volume. This chemical overload produces the severe hallucinations and paranoia that define a psychotic break. Because this looks so much like a physical brain injury, doctors have to run intensive medical tests. They use brain scans and electrical monitoring to ensure they aren't missing a hidden physical cause, like an autoimmune attack on the brain. This proves that what is happening is a profound, measurable failure of the body's physical hardware, not a psychological flaw. To repair this crisis, doctors use a specific medical ladder. This is a step-by-step treatment plan designed to stabilize the brain's internal control room. Step 1 uses powerful calming medications to force the brain to sleep and reset. Step 2 adds reality-anchoring medications to cool overactive excitement signals and fade hallucinations. Step 3 introduces long-term mood stabilizers, like a heavy anchor, to prevent relapse. When this specific sequence is used, over 98% of mothers reach full recovery, proving this biological emergency is highly manageable. The modern gold standard for recovery uses mother-baby units. These are specialized wards where a mother receives psychiatric care while staying with her newborn, allowing them to bond safely under expert supervision. But the healing doesn't end when the psychosis stops. Waking up from this crisis often leaves mothers with a profound sense of trauma and guilt over thoughts they couldn't control. Through specialized therapy, many survivors experience what is called post-traumatic growth. They slowly rebuild their lives, often emerging with a deeper sense of compassion and a stronger connection to their families. True recovery requires a dual approach: precise medication to fix the brain's biological hardware, and compassionate therapy to help heal the heart. Got questions about psychology, neuroscience, or the brain? Drop them in the comments below, along with your ideas for our next video. And make sure to subscribe to SM Says Psych for more amazing content.